We previously said that the position of the head is what will determine the position of the oncolytic membranes, which are in contact with the hair cells of those two maculae, of those two sacs, which are the utricle and the saccule. Alright, so let's get a bit understanding of this. Alright, so what really happens is this: when the head is not moving, the stereocilia, remember the stereocilia that are on the apical surface? Good. When the head is not moving, the stereocilia are deflected, and their deflection is due to gravity. Why? Because the otoliths are heavier than the endolith. When the head is moving, or when the head is tilted, or when an individual is moving, the stereocilia again is also deflected, but the deflection is due to inertia dragging them on the oncolytic membrane. Okay, what we are stating now here is that the stereocilia, okay, they are embedded in the what? In the oncolytic membrane. Alright? Now, deflection, we are referring to them bending, alright? Bending away from that oncolytic membrane. So that bending, okay, would be caused by the movement of the endolymph, is it? But how? When the head is not moving, their deflection will be due to gravity. But when the head is moving, or it is tilted, or an individual is moving, the deflection of these, or the movement, the bending of our stereocilia will be due to inertia. How? Because the endolymph was static, right? The endolymph was static. Okay? Now, when you move, it changes what? It changes position. And what will cause it to move? There is effect of inertia. You remember in physics. Okay? Yes, so that effect of inertia, when someone is moving, is what would drag our stereocilia, dragging them on the oncolytic membrane. So they are deflected. They are bending. Okay? Now, this bending, friends, is so significant, so important, okay? It's very important because this deflection or this bending of the stereocilia is what will change the hair cells' resting potential and their rate of neurotransmitter release to the afferent nerves. The bending of the stereocilia will change the resting membrane potential of these cells, of the hair cells, okay? And when the resting membrane potential is changed, that will also affect their rate of neurotransmitter release, which will be released to the afferent nerves. And this is the basis of mechanoelectrical transduction. That is, this is the basis of the conversion of mechanoelectrical energy into energy that will cause action potentials of nerves. How? Because if our stereocilia, when they are deflected, and they are deflected towards the kinocilium, remember the kinocilium, that modified cilium on the apical, right? Now, when these stereocilia are deflected towards the kinocilium, okay, what will happen? Remember the links, remember the link proteins that were at the apical, okay, of these stereocilia. Good. So when the stereocilia are deflected with the kinocilium, the link proteins will be pulled. Hence, that will cause opening of the mechanically gated potassium channels. So the mechanically gated potassium channels will be done what? Will be opened because the link proteins will be pulled. Why? Because the stereocilia have been deflected towards the kinocilium. And the result is that there will be potassium influx. The potassium that is from the endolymph Now we'll get into the what? We'll get into through these stereocilias, okay, and reach to the cells, is it? And that would cause polarization of the cells membranes. The hair cells, they will get to be polarized. Their membrane, there will be polarization. Remember in physiology. Okay, so when now it is polarized, this polarization, friends, would cause, what would it cause? It will cause at the bilateral membrane, okay, the bilateral membrane of these cells, okay, the calcium voltage gated channels will be opened, and that will cause calcium influx. Calcium influx meaning the calcium now will get into the what? Into the cells. All right. Now the calcium influx will result in neurotransmitter release. So the neurotransmitters that are in these hair cells, okay, will be now done what? Will be released. Is it? They are carrying information that need to be taken to the brain to do what? To interpret the position in which our head is in. Okay? So the calcium influx, which will be caused by the polarization, all right, of the membrane, of the cell's membrane, okay, will cause calcium to get in. Is it? This calcium getting in now will cause or will result in neurotransmitter release. Hence, this deflection would increase the rate of neurotransmitter release. Yes, because these calciums that are getting in, they are causing the neurotransmitters to be released from the what? From the cell. When they are released from the cell, they reach to the what? Remember, we are having that apical surface, we are having what? We are having our afferent terminal endings, is it? Yes, so they will be received, all right, and now information will be sent through those branches or vestibular branches of the cranial nerve number 8, and they are taken now to the what? They are taken to the brain, and now information will be interpreted. So in summary, all in all, is that what we need to remember is that the stereocilia, when they are deflected toward the kinocilium, that would increase the rate of neurotransmitter release. Now, if the stereocilia, what happens if they're deflected away from the kinocilium? When they are deflected away from the kinocilium, that would cause those tip link proteins to slack. When they slack, the mechanically potassium gated channels of potassium will be closed. So when they are closed, the cells become hyperpolarized. Hence, even the calcium voltage gated channels, they won't open, they will be closed. And because they are closed now, there will not be release of neurotransmitters to the nerves. So, what are we getting? We are getting that now the stereocilias, when they're deflected away from the kinocilium, that would cause no release of neurotransmitters. So the sensory impulses from the maculae of the vestibular complex, they will move toward the cranial to the central nervous system via the branches of the 8th cranial nerve, and are interpreted along with those inputs from the semicircular ducts and other sources to help maintain equilibrium. So this is it. What we are saying now is that the semicircular ducts also, there will be some neurotransmitter that will be released from there. Now, the neurotransmitters also released from the utricle and the saccule, from the macula of the utricle and the saccule, together with those released from the semicircular ducts, they will move together, going to where? To the central nervous system. Through what? Through the branches of the 8th cranial nerve. Okay? And there they will be interpreted together also with the other, from other sources to help maintain equilibrium. Now let's have some medical application of this. The medical application so far that we can, have applied to this knowledge is this. Okay? There are problems of vestibular system that come about with our patients. All right? the vestibular system can result in vertigo. What do we mean by vertigo, friends? You know, when someone feels dizziness, and a sense of body rotation and lack of equilibrium, this is what we are talking. You remember when we started, right? When you feel dizzy, okay? Dizziness, and you are failing to stand. You are even seeing like things are moving, okay? That condition we call it vertigo, guys. What could cause vertigo? Vertigo could be caused by the spinning. When you are spinning the body, that would produce vertigo. When you know those rotations that we used to do, eh? You rotate, and then what happens? You fail to stand. That is vertigo. Why? Because our crystal ampullars of the semicircular ducts were overstimulated. Okay, so overstimulation of our crystal ampullars of the semicircular ducts would cause what? They will cause vertigo. Overstimulation of the macula of the utricle caused by repetitive changes in the linear acceleration and directional changes can normally lead to motion sickness. Good. So, when the maculae of the utricle and the saccule they are overstimulated, that would lead to motion sickness or seasickness, guys. Now, vertigo that is associated with rapid head movements can also be produced by internal ear inflammation. What I'm now telling you, friends, is that the internal ear, the inflammation of the internal ear is known as vestibular neuritis. And when one has got vestibular neuritis, when they try to rapidly move their head, that would also cause vertigo. Okay? Manure disease. Manure disease involves episodes of vertigo accompanied by hearing loss and ringing in the ear. Some people will come with cases where they're having vertigo, meaning they're having dizziness and they can't maintain balance, but at the same time they're having problems in hearing, they're having hearing loss, and they're even hearing some like ringing in their ears. Ringing in their ears is known as tinnitus. Okay, but this condition entirely is known as Manure disease. What causes it? Manure disease is caused when there is increased pressure within the membranous labyrinth. Increased pressure within the membranous labyrinth is known as endolymphatic hydrops. So what we are saying now is that endolymphatic hydrops can result into the Manure disease. Endolymphatic hydrops actually leads to rupture and linkage of endolymph into the perilymph. So these are some medical applications that we can apply to the knowledge that we have acquired so far. Join me now in the next one when we will get to learn about the semicircular ducts. See you, brother. Yes. Family, we can talk.
What causes the ringing in the ear? What did you say?
Ringing.
Yes.
What causes ringing? Wow, you ring in your ears.
Hey!